Hi, I'm Dr. Groff, and we're here today with my patient Tasha. It's a very exciting day for her because today we're going to do some liposculpture on her. Now she's 30 years old and has 2 beautiful children, and as a lot of mothers know, after having their children, it can be a little bit difficult to get the tummy area back to the way it was. So, you know, our goals with liposculpture are, of course, to kind of sculpt and reduce the amount of fat in the abdominal area and get it closer to the way it was before the patient had her children.
I try to go to the gym to get rid of the belly bulge, and for some reason after my 2 kids it's been very hard to do so.
Right.
So I wanted to seek out your help to reduce the bulge.
Okay, so we just finished marking out Tasha's abdomen, and you can see where we're going to concentrate on the areas where there's obviously more volume, and then we'll taper it out to the side so it looks very natural. We're also going to do the upper abdomen here because there's a little bit of additional volume here as well as the lower abdomen. So we're ready to go to the next stage, which will be where we numb up the area. So we're here with our patient Tasha. Now she's wide awake. She does have a little medication on board for sedation and just to relax her, but she's breathing on her own. She's not under general anesthesia, which is much safer to do it this way. This is called the Tumescent technique. So what that means is we're filling the area with a numbing solution. It has lidocaine in it, or Novocaine as it's commonly known, and that helps numb all the area up. The advantage to this technique is it's a lot safer. There's zero bleeding and or blood loss, and we're able to treat the whole area while she's awake and breathing on her own. And we can ask her questions, we can talk to her while we're doing the procedure, and she's completely comfortable. So we've begun the liposculpture procedure, and she's resting comfortably. She's wide awake. You can actually talk to her and say hi. So how are you doing back there? Are you feeling okay?
Yes.
Okay, so you can see she's wide awake. We've done about maybe half of the case so far, and there's already a lot less tissue, or adipose or fat tissue, and but we still have some work to do. But this is one of the cannulas that we use. You can see it's very small, which enables us to actually sculpt the area and make sure there's no lumps or bumps and unevenness. So one of the advantages of the Tumescent technique is that you get out almost pure fat, and it's a bloodless procedure where there's, again, much less risk of complications when doing the Tumescent liposculpture technique. You can see it's this pure fat tissue that we've gotten out of the abdomen.
The experience was very non-painful. It was very comfortable. The nurses and the doctor were great, and I'm excited to see the results.
So what we'll do is we're going to have Tasha come back tomorrow, and we'll take down some of her dressings and we'll take a look. Of course there'll be probably a little bit of bruising and some swelling and things, but you'll be able to see then that there's really minimal downtime, and she'll probably be back to work in 2 days. How are you feeling?
I feel great. A little discomfort, very minor, but
Right.
I was able to walk around, and it was a good day.
Kind of like when you work out and you get a sore muscle, that kind of soreness,
Yes,
maybe?
exactly.
Okay,
Yeah.
so we did Tasha's procedure yesterday, which is a Wednesday. Today's Thursday. She could really go back to work tomorrow if she wanted to, but certainly she can go back to work on Monday. And she's not taking any pain medications. She has very little discomfort, and she can go about her normal daily activities.